In order to have quality care, we need to make sure that the nurses are at the front lines. We are the ones who are at the front lines providing the quality care. 25 years ago, I had the opportunity to become a nurse. I had reached for other professions, but nursing was the one that grabbed at me. Nursing was the one that I wanted to take care of my fellow men. I thought that I could make a difference in the world. But unfortunately, there are conditions in hospitals where nurses are leaving the nursing profession outside of the hospital. Some of the care inside the hospital, we give quality care. All nurses give quality care to the best of their ability. But it is very difficult to give good quality care if you have sick patients. 25 years ago, or even 15 years ago, the patients that I now take care of were in an ICU setting. Now I am expected to take care of 5 to 6 patients who would have only had 1 nurse to 2 patients 15 years ago. The importance of quality care is to make sure that we have enough staff to take care of the amount of patients that come into our hospitals. Unfortunately, throughout this nation, I have spoken with nurses throughout every state in this nation who have been very upset that they have to decide what kind of care to give their patients, whether they can sit down and teach that patient good quality care of themselves when they leave the hospital, or whether they have done everything possible for them. Nurses are leaving the profession because, unfortunately, there's too much stress. They're worried about whether they are going to lose their license because they have those 8 patients to take care of. Fortunately, with the hospital that I work in, I don't have that worry, but some of the others in my community does, as well as nurses throughout the nation. When we do come together to decide on good quality health care, we need to make sure that the nurses are part of this good quality health care, as well as those who help in providing that good care. I have been told by several nurses when I have approached them, they say, "Are you encouraging anyone to go into your profession?" And as a matter of fact, right now, I do have a daughter who plans on going into the nursing profession. Have I discouraged her from doing that? Absolutely not. Because we need good, strong nurses who are willing to stand up for what they believe is important. And she needs to be a voice among the rest of us nurses to stand up for good quality care for all those in this nation who need it. People are sicker when they come into our hospitals. Our hospitals are much more crowded, but we do need to make sure that we have plenty of nurses available and give them the opportunity to come back to the hospitals, but come back in a good setting.